This program is proudly brought to you by Daytech PNG Limited and Telecom Limited.
Good evening, Papua New Guinea. I'm Malcolm Waira, and welcome to another episode of Infocus. In this episode of Infocus, we discuss the malaria disease in Papua New Guinea. Joining us for discussions, we have Mr. Leo Makita, Program Manager for the Malaria Control and Other Vector-Borne Diseases Control under the National Department of Health, and Mr. Tim Freeman, Program Manager for Rotarians Against Malaria. Gentlemen, thank you for joining us.
Welcome. Thank you.
Good evening, listeners and viewers.
Okay. Firstly, Leo, could you explain what is malaria and the main types of malaria that are prevalent in Papua New Guinea?
Malaria is a disease that is caused by a parasite. To put it very simply, the parasite is actually transmitted from person to person by a mosquito. We have 4 different types of human malaria. There are 4 species. In Papua New Guinea, 2 of them are highly prevalent, that is falciparum malaria and vivax malaria. Falciparum malaria is the one that is most likely going to kill people. It's a very, if not treated, it can become very deadly. Vivax, on the other hand, can make people sick. But with Vivax, what happens is that they actually hide in the tissue cells of the human being. So anytime they come out again, causing malaria to the patient, to the person. So you have got these 2 very specific parasites. The other 2 is not very important in Papua New Guinea at this stage.
Now, Tim, I understand your organization is the Rotarians Against Malaria. Could you give us a brief background and history of the organization?
Rotarians Against Malaria is part of the Rotary Club of Port Moresby. It's a project of them. And they started this project back in 1997 when some of the members were, I think it was Pom General Hospital, were visiting there and they saw a child die in front of their eyes, and they decided at that time they wanted to do something about malaria in PNG. And I think right from the beginning they linked up with the National Department of Health, and as far as I know they've been with Mr. Makita for the whole time. So we've created a partnership. In the old days this was bringing in nets to sell them. And then as we went along, we became more and more involved with the Global Fund, because for those who don't know, the Global Fund is an international organisation that funds malaria in PNG. And from 2096, we were assisting the department in bringing nets from overseas. And then for various reasons in 2010, we became the implementing partner. So in other words, we started coordinating the distribution of nets in PNG from about 2010.
I understand there are specific types of mosquito nets that are used particularly in Papua New Guinea. Could you just give us a background on them?
Yes, we have all the nets that we've had in this country made of polyester. But recently, due to a number of issues, we started to get polyethylene nets. Nets come in either conical or square nets. We generally think for rural areas the square nets are more appropriate. The conical nets generally are better for urban houses.
Okay. I understand you are part of the malaria control program in Papua New Guinea. Could you tell us about the main components of the program?
Well, we do this all together with Mr. Makita here. So yes, the components of the program are, first of all, we have this massive net program where we reach every targeted village who lives in malaria areas every 3 years. We also, in the recent years, become part of delivering drugs to the health centres, and to do that we have a team of officers that come under both our controls who visit all the health centres in the country every 3 months and deliver drugs. A very important programme has just started since 2020. We are training people in rural areas, in villages, to test and treat malaria, particularly those villages which are long distance from a health centre. And this is now in 10 provinces and expanding. And yes, we also have some other small programmes which we fund, such as doing research with Miss Makita's department for testing drug efficacy, and we also work very closely with the PNG IMR, the Institute of Medical Research, on various aspects of malaria control in the country.
Thank you. Tim? We now go for a quick break. When we return, we look at how geography is affecting the prevalence of malaria. Welcome back. You're watching In Focus. Now, Tim, PNG can be roughly divided into 4 epidemiological zones, which are areas of incidence and distribution of malaria disease. Could you briefly explain each of them?
Okay, the worst parts of the country are basically the coastal areas, which are below 1,200 metres. And this is where malaria is worse and is known as being epidemic. We also have a zone, I have to explain that malaria is very temperature dependent, so as you go higher it gets colder, so that's why it's linked to altitude. So when we get up to 1,200 metres, it becomes it's where malaria starts having difficulty surviving, but sometimes it warms up and we can have epidemics. So we have this, what we call an epidemic zone between 1,200 and 1,600 metres. Now, when you get up to 1,600 metres, at the moment it's probably too cold for the parasite that Mr. Makita mentioned, which is falciparum malaria, but vivax can survive at lower temperatures. So from about 1,600 to 2,000 metres, we get very low transmission of this parasite, Plasmodium vivax. And then above 2,000 metres is too cold, so districts like Kandet, for instance, in Enga, really don't have any malaria because it's far too cold for it to happen.
Leo, to what extent has climate change affected the prevalence of malaria?
Climate change is a very, very important factor in terms of transmission of the disease, because you are looking at the life of the mosquito, the life of the parasite, and the activities that people get engaged in. So temperature and altitude are very, very important factors in deciding where you do what. You know, when you look at the temperature, as Tim had mentioned a little earlier, when you look at the temperature as you go up, and then the survival of the parasite in the mosquito is reduced. So that is why you do not have malaria in parts of the highlands, because it is a little bit high. You have to consider this very carefully when you are deciding to do control measures, because temperature plays a lot of a role in the transmission of malaria. That is why it is so important for us to understand this, the life cycle of the mosquito, the life cycle of the parasite, and behavior of people as well.
Have there been extensive studies to ascertain the geographical prevalence of this malaria pandemic? I think you mentioned there were some studies conducted in coordination with the Institute of Medical Research. Could you highlight some of the key findings from some of those research?
Well, in terms of epidemiology and where you find malaria, that kind of research has been going on since 1945, so it's not a new program. Malaria has been around for a very long time. So you mentioned climate change, for instance. I think that what Leo forgot to mention is as temperatures get warmer, potentially places like Kandet, maybe in the future, as it gets warmer, may become malarial. So that's the biggest challenge we have. It's not become so apparent in the last 10 years, but it could change, and if anything goes wrong, we could start getting epidemics in these areas and later on.
And now, Tim, I would imagine the logistical challenge of your operations as your organization is particularly involved in the distribution of nets. How is your organization working around providing that support to geographically isolated communities?
The only limitation in PNG is money, because yes, it's a very complicated country. Only less than 50% of the population have access by roads, so a lot of places in PNG you can only reach by boats, or in worst cases aeroplanes, and in some places really only by helicopters, or having very, very long treks into these places. So the first challenge is the terrain or lack of infrastructure, so roads don't go to a lot of places in PNG. On top of that, you've got the weather, and roads in PNG are not the best in the world, so when it rains, it makes it far more difficult to travel down a lot of those roads, and so that slows us down a bit. And then in recent years, the bigger problem for all of us has been security. Been highlighted places like Enga, for instance, but it's not just Enga, it's all over the country that we are been having issues. And for instance, when we're distributing nets, we just had an incident only 2 or 3 weeks ago where some drunks in the middle of a crowd just came out and belted one of our volunteers while he was just doing his job. So this is an increasingly bigger problem for us. But at the end of the day, it's money, and as long as you have money, you can do anything you want.
So are there any partnerships that you have with local communities or local organizations as well?
Well, our major partner at national level, of course, is our friend here, Mr. Makita, and the National Department of Health. And when we go into the provinces, our major implementing partner are the provincial health authorities in each place we go to. And then, yes, it's a little bit ad hoc. Wherever we go, we are working with whichever communities we find, because we only have 20 guys involved with distributing nets. So when they go there, they're like facilitators, and we work with health centres and local communities to get this done together. So our partnership's really everybody on the ground. But yes, we are, particularly with our HMM programme, we're reaching out now to look for partnerships, because often we have staff based by themselves in very remote places, and it's very difficult to supervise them. So for instance, in Ayatapi, we're working with the Catholic Church to see if we can have a partnership there for them to assist us looking after this HMM programme, Home Management and Malaria programme that we have there.
You mentioned the home management programme. I understand it's tailored specifically for smaller, close-knit communities. Could you just give us a background on it?
The major problem in PNG, because of terrain, is access to health. So while we have about 800 health centres and probably 3,000 plus aid posts, there's still a lot of places where you have to walk more than 2 or 3 hours, or sometimes a day, to get to your nearest health facility. So this idea is taking the health services beyond the traditional health system into the villages. So what we're doing is we're training villagers in remote areas how to test and treat malaria. And this is now slowly expanding. So we have about 15, I think between 1,500 to 2,000 volunteers around the country now doing this.
Thank you, Tim. We now go for a quick break. Join us on the other side for more discussions. Welcome back. You're watching Infocus. Now, Leo, the government recently launched the PNG National Strategic Plan 2021 to 2025. Can you tell us about the key objectives of this plan?
Okay, to go back a little bit, the plan itself covers a period of nearly 5 years all the time. Every time we write a plan, it's for about 5 years. And it encompasses what the program plans are within those 5 years. So we sort of write the plan in such a way that we try to include every possible way that we can be able to control malaria in Papua New Guinea. So the document itself is not a document that comes from my office. It is a document that is jointly prepared by all participants, including PHAs and also other partners. So we do we do have a lot of consultancy that goes into preparing such plans, because it has got a lot to do with how the program will move within the next 5 years. And we have always tried to align the plan with the National Health Department plans, which also goes up to about 2030. So our plans are always aligned to the government, official health department plans. But the objectives that we try to use is like issues like resourcing, issues like health promotion, issues like administration and management of the program. So it covers a wide range of issues that we see as important to deliver the malaria program in Papua New Guinea, plus of course other vector-borne diseases.
Now, team, how have you found the plan? Is it an improvement from the previous strategic plans launched by the government?
Oh, that's a very difficult question. It has everything in it. And we were part, as Leo said, this was created by partners, and he forgot the community as well. So we have to have consultation at all levels of society to come up with this plan. So it's the best that we can come up with, given the resources that we have. But it's also not only covers what we actually do, it covers what we'd also like to do. So there are many things here in the programme that we don't do, not because we don't want to, but we don't have the money to do so. So, for example, having a very strong behavioural change communication programme. For instance, we did some adverts on EMTV only about 3 or 4 months ago, but we'd like to do that a lot more often, and we don't have the money to do so. The HMM programme, for instance, we'd like to be a lot bigger, but we are constrained by the amount of cash that we have. There's also, in terms of vector control, we have things called indoor residual spraying. We just simply don't have the money, but it's something we keep looking at and seeing what we can do to expand those things. So basically, it's a wish list of everything we'd like to do for malaria in the country, and it's good.
Are there avenues which the community or perhaps the private sector can support your activities as well?
Well, I think the major thing is about malaria. If you have development, malaria tends to disappear. As you get better housing, people living in better conditions and such like, malaria tends to disappear. And what most people forget is that it's not the government's job to get malaria, it's everybody's job. So just by putting screens on your windows, for instance, you're stopping the mosquitoes coming in. So your job, if you're doing your job properly, is to protect yourself from getting bitten by malaria transmitting mosquitoes. And there's many ways you can do this. So really, malaria control starts at home, and we just are there to assist those people in doing this.
You mentioned the difficulty in securing adequate funds for your operations. I understand you have some other partnerships, particularly from local partners as well. As you mentioned, Global Fund is a major supporter of your program. Are there other organizations that support your work as well?
The biggest supporter we have in Western Province is PNG Sustainable, and they pay for most of the costs in that part of the country. We also get small bits of money, and occasionally we have support from people like ExxonMobil and also from Rotarians in Australia and sometimes Rotarians here in PNG. So, but the reality is 90%, 95% of what we do is paid for by the Global Fund. And that in itself is a partnership of many, many countries. So the Global Fund is being supported by Australia, Japan and all the other countries in the world. So it represents a multi-country initiative.
Finally, are there any future plans here for the malaria control program? Perhaps I'll start with Leo.
Yeah, our future plans, it is more of a wish. Throughout this region, we've got a target to eliminate malaria by 2030. And that is not only Papua New Guinea, but the whole region in the Western Pacific region. So we sort of driving our activities towards that goal, and it is an initiative that was signed on by prime ministers of all these countries in the region. So it is a very high level commitment that had been made for a malaria program in all these countries. Some have already eliminated, others have not. PNG has got the highest burden, and we are still struggling to be able to beef up enough resources to be able to do, implement our wish list. And if we cannot, if we cannot look at other issues or other strategies that are able to perform in the same way as the mosquito nets, then reaching the target is most likely going to be impossible. And while talking about targets, you need to keep in mind that although we may not be able to reach elimination, we would like to drop the burden down to very low levels so that people don't have to suffer. Children don't have to suffer. Pregnant women don't have to suffer. Unborn children, are born healthy. So these are the issues that we try to look at that has got a bigger role to play within the program itself. I think Tim rightfully mentioned that resourcing is a very big constraint for us. So if we're able to get that, we can be able to perform some of the things that we wish we could perform.
Yeah, I'd like to add on that one is that money is not only the constraint. I mean, for example, when we give out a mosquito net, our biggest challenge is to get people to use those mosquito nets consistently. As Leo says, this is PNG has the worst malaria in the Western Pacific, and unfortunately at the moment it's getting worse, not better. Does it mean we can't win? I think we can win, but it does require everybody coming on the table. And I'd like to just give an example of Bougainville, where malaria is actually the lowest for a coastal area in the country. Bougainville has the lowest malaria anywhere in PNG, and that has been a result, in my mind, from a Healthy Islands village where there's been a big initiative in Bougainville getting villages to clean their act up, to put screens on the windows and such like. And basically South Bougainville is the only coastal place in PNG where there's practically no malaria whatsoever. The other exception is Port Moresby. There's very little malaria in Port Moresby for the same reason, well, not for the same reasons, but we have an urban area which is very developed, so it's difficult for the mosquitoes to breed. But if you only go 20 kilometres outside of Port Moresby, you have some of the worst malaria areas in the country here. And the biggest challenge is getting communities to help themselves and sort this problem out. So one of our biggest challenges is to get communities to work together, to fight together with the government to solve this problem.
Thank you, gentlemen. Unfortunately, time has caught up with us. Before we go, I'd like to take this time to thank our special guests, Mr. Leo Makita, Program Manager for the Malaria and Other Vector-Borne Disease Control Program under the National Department of Health, as well as Mr. Tim Freeman, Program Manager for Rotarians Against Malaria. Gentlemen, thank you for joining us.
Thank you for having us on the program.
Yeah, thank you very much. It was a great pleasure. Thank you.
Thank you for joining us. Do join us again next week, Monday, on our regular time slot of 7 p.m. Till then, good night.
This program was proudly brought to you by Daytech PNG Limited. and Telecom Limited.